hip resurfacing was designed and advocated for young, physically active, sporty patients. Unfortunately, in the last few years, we've seen that some of these patients have developed complications as a result of sensitivity to the metal debris that's produced by the joint replacement. As a result of this, the popularity of hip resurfacing has really reduced, and there's a lot of discussion as to, in fact, whether resurfacing is appropriate. A lot of research is being done, and what we may find in the future is that either the popularity of hip resurfacing will increase again if we identify a test to determine which patients are prone to this metal ion sensitivity, or a new generation of hip resurfacings will be developed using different materials such as ceramics.